Hello everyone in CardioMind's channel, and today we are starting the series of lifestyle optimization, and we are speaking today about exercise and diet. When we speak about the elements of lifestyle modification, we mention the physical activity, which means exercise. We mention the nutrition, means a healthy diet, resulting of course in the body weight and composition, and also mention the mental health and the smoking intervention. Today we are focusing on the physical activity and nutrition, which of course have positive impact on body weight and composition. Let's start with the physical activity. Needless to say that there is an inverse relationship between moderate to vigorous physical exercise and all-cause mortality, cardiovascular morbidity and mortality, and also the incidence of type 2 diabetes, because we know that the increase in the exercise has a positive impact on the risk factor control that result in the atherosclerotic cardiovascular disease. And when we try to assess the level of exercise performed by an individual or try to advise someone to start exercise, we should not just tell him, do regular exercise. We need to give him clear instructions and advice regarding the frequency of exercise, the intensity and type of exercise he should do, the duration per day and per week, and also the level of progression that he needs to do in order to increase his level of exercise. We can advise him to use a wearable activity tracker that help him to increase the level of exercise gradually, and also we need to encourage them to start the activities that they enjoy or they can include in their daily routines, like for example jogging or cycling, and they are more likely to be sustainable. The most common type is the aerobic exercise, which recommends the adults to perform at least 150 to 300 minutes a week of moderate intensity exercise, which is equivalent to 30 to 60 minutes of exercise per day for at least 5 days a week, or 75 to 150 minutes of vigorous intensity exercise, which is equivalent to 15 to 30 minutes exercise per day at least 5 days a week, or an equivalent of both throughout the week. Older adults who may have some chronic conditions like for example spine disease, osteoarthritis in their knees, that may limit their activities. In this case they cannot fulfill this minimum duration, so we need to encourage them in order to stay as active as possible with gradual increase in the activity level. If they can't achieve, for example, 150 minutes of moderate intensity exercise a week at a time, I can encourage them to have a less duration, and then they can build up the duration in order to increase it gradually. So they should avoid sedentary life. And when we assess the aerobic exercise, we can use the absolute intensity, which is the amount of energy expended per minute of activity, which can be assessed by oxygen uptake per unit of time, or by the most famous metabolic equivalent of task, the MET, which is of course famously used in the treadmill test. Or we can use the relative intensity, which we can assess using the percentage of cardiorespiratory fitness, percentage of peak heart rate achieved by the patient, or the rating of perceived exertion according to the Borg scale. The other type is the resistance exercise, which includes some isometric exercise that help to strengthen the muscles. It is associated with lower risk of total cardiovascular events and all-cause mortality. That's why we need to prescribe each individual to perform both aerobic and resistance exercise. It has a complex prescription as shown here, which may need a trainer in order to train the individual to perform adequate level of resistance exercise that could produce benefit for his body. For the elderly, they are recommended to perform multi-component physical exercise that can combine aerobic exercise with some muscle strengthening exercise that help them to prevent falls and keep them as active as possible. And the complete opposite, of course, is the sedentary behavior, the common challenge that is facing our generation at the time being. Of course, it is associated with greater risk for several chronic disease and mortality, and they increase the incidence of risk factors for atherosclerotic cardiovascular disease. And for physically inactive adults, we should encourage them to start at least the light intensity physical exercise. For example, 15 minutes a day. It is not difficult, which can produce benefits for them, and then they can build up and increase the level of exercise. So I cannot take a sedentary individual to perform 30 minutes a day or 5 days a week. No, I should start with a light intensity exercise that increases gradually because the sedentary behavior has a lot of detrimental effects on the patient's risk profile. So the task force this year reached a class 1 recommendation to perform at least 150 to 300 minutes a week of moderate intensity exercise or 75 to 150 minutes per week of vigorous exercise or an equivalent combination of both. And for those who have chronic disease or elderly population who cannot perform this 150 minutes, at the time they should stay as active as their abilities and health the condition allow. And it is recommended to reduce sedentary life for all individuals by encouraging them to engage in at least light activities throughout the day, and performing resistance exercise has also class 1 recommendation plus the aerobic activity and recommended on 2 or more days per week, which help to reduce mortality and strengthen the muscles. Let's move to the lengthy part of our video today, which is the nutrition. We all know that the dietary habits affect the cardiovascular risk either by positive impact or negative impact through its affection of the risk factors like the lipids, blood pressure, body weight, and diabetes. And of course, nowadays there is a growing concern about environmental sustainability that support a shift from animal-based to plant-based food pattern. That's why there is a growing rise of the concept of vegetarianism, which increases the use of plant-based food, but it allows the use of some products like the egg or milk. And there is a more absolute veganism, which prevents the use of any animal-based products, even the eggs and milk, or the use of any products from the animals, or even the raising of animals. So we can say that there is a class 1 recommendation for a healthy diet as a cornerstone of cardiovascular prevention in all individuals. You cannot advise anyone about the prevention of cardiovascular disease without speaking to him in detail about the healthy diets. So what is a healthy diet? As a patient would ask you, what should I eat and what I shouldn't eat? First of all, the famous comparison of unsaturated versus saturated fats. The polyunsaturated fats, monounsaturated fats, and carbohydrates from whole grain or reduce the risk of coronary heart disease when they are isocalorically substituted for the dietary saturated fat by the numbers mentioned here in the parenthesis. So, we should encourage the individuals to reduce their saturated fat intake to less than 10% of their total energy intake, which includes the fat present in animal meat, for example, or in dairy products, to be replaced by unsaturated fats, which can come from vegetables, come from fatty fish, can come from whole grains, or from legumes. So, these types of fat should be encouraged in the patient's diet. However, the LDL lowering effect of this substitution may be less in obese than in normal weight person, but this should not reduce the importance of encouraging the people to replace saturated fat by the unsaturated fats. But what about the trans fats, which of course is a famous term of the margarine? Trans fat is a type of fat that is produced during the industrial processing of fat, which converts the liquid oils into solid fats. This process has completely unfavorable effects on raising the total cholesterol and reducing the HDL cholesterol. And so, any 2% increase in energy intake from trans fat is associated with 23 higher risk of coronary heart disease. This can include any types of fried foods, includes the commercial bakeries like cakes, biscuits, pies, muffins, or donuts, and includes the non-dairy creamer. That's why we should advise the patient to reduce the trans fats or even avoid the trans fats as much as he can, because it is a dangerous type of fat that is even more dangerous than the natural saturated fat present in the red meat, present in the dairy products, because the former type is a natural fat, but this is an industrial processed fat. What about the lovely minerals and vitamins in our diets? Of course, we know that the potassium in fruits and vegetables has favorable effects on blood pressure and reducing the risk of stroke. Also, there are some observational studies that found inverse associations between vitamins A and E and the risk of cardiovascular disease. Does this mean that we should encourage the patients to take supplements of vitamins or minerals? So far, no interventional trials confirmed these associations, as a trial that supplemented the patients with vitamin B, C, or D did not show any beneficial effects regarding reducing the risk of cardiovascular disease. So we should remind ourselves that the dietary supplementations of vitamins and minerals should be encouraged, like the intakes of fruits, vegetables, whole grains, legumes, but the pharmaceutical supplementation in general without specific indications is in vain. So we should not encourage the patient to take any preparations of vitamins or minerals just to reduce the risk or to protect themselves, because there is no evidence so far for this practice. And on the contrary, the white poison, the sodium, we all know it's dangerous, but just to summarize, we can mention the test trial, which showed a dose-response relation between sodium reduction and blood pressure reduction, and also in a meta-analysis, salt reduction of 2.5 grams per day resulted in 20% reduction in the risk of cardiovascular events. And the effect of reducing sodium intake is much more in hypertensive individuals than in normotensive, but we should encourage all individuals to reduce their sodium intake. And so the evidence at the time being needs to reduce the salt to less than 3 grams per day, which is the optimal level to prevent coronary heart disease and stroke. So when we advise a patient, I should advise him about adding salt to food, which is a dangerous practice in our diet, but this is not the only source of salt. We should encourage him to reduce or even prevent the intake of pickles, all cheese, herring and salted fish, chips, or salted nuts, because when we speak to the patient about the importance of eating nuts in his diet, I should advise him about the unsalted nuts versus the salted nuts. Needless to say about the benefits of fruits and vegetables, but we should remind ourselves that each additional serving of fruits or vegetables per day, which is nearly equivalent to 77 to 80 grams, results in a 4% lower risk of cardiovascular mortality, which reach a peak benefit with 5 serving, but it doesn't exceed this benefit with more than 5 serving. And there is a 26% lower risk of stroke with 5 servings per day compared with 11% lower risk with less than 3 servings. That's why we should encourage the patient to take 3 to 5 servings of fruits or vegetables per day, besides single portion at least of pulse or legumes per day, which is associated, of course, with lower LDL cholesterol and lower risk of cardiovascular disease, like, for example, the beans, the red beans, chickpeas. All of this result in reduction in risk of cardiovascular disease, besides fruits and vegetables. There is a great emphasis about the importance of dietary fibers in our diet, as each 7 grams per day higher intake of total dietary fiber is associated with 9% lower risk of coronary artery disease, and a 10 grams per day higher intake of fibers is associated with 16% lower risk of stroke and 6% lower risk of type 2 diabetes. But the question that forces itself upon our minds: why the dietary fibers are so important in our diet and what maximize its benefits? The high intake of dietary fibers result in enhanced GIT motility, which reduce the intestinal transit time and so reduce the glucose and fat absorption. This, of course, had a great benefit in reduction of the postprandial glucose response after carbohydrate-rich meals and reduction of the triglyceride levels. So if we make a famous question that what is better, to eat a piece of fruit, for example, eating a piece of orange, or to put this orange in a glass of juice that you can drink? Of course, the answer is eating a piece of fruit is much better, because in this case, the dietary fibers in this fruit will reduce the postprandial glucose response, so it is much more beneficial to eat fruits rather than drinking them as juice. The nuts are an essential component of any healthy diet, including hazelnuts, almonds, pistachio, and walnuts. We can say that daily consumption of 30 grams of mixed, unsalted nuts is associated with 30% lower risk of cardiovascular disease. Also, we can mention that legumes and nuts contain dietary fibers and bioactive components, including the antioxidants, which can help to reduce the risk of cardiovascular disease. That's why we should encourage our patients to take unsalted nuts and avoid the salted nuts, because unfortunately many of the nuts in the markets are salted nuts. So at the time you are taking a benefit of the nuts themselves, but taking the danger of taking excess salt. Fish is also an essential component of any healthy diet, as eating fish once a week, particularly the fish rich in polyunsaturated fatty acids, including the fatty fish like salmon, herring, and mackerel, is associated with 16% lower risk of cardiovascular disease, and eating fish 2 to 4 times a week is associated with 6% lower risk of stroke. That's why we should encourage our individuals also to intake fish at least once a week, which help to reduce the risk of cardiovascular disease. And we can see this routine dietary practice in the East Asian countries. The red meat is a famous component in our diets, but it has some dangers. Yes, restriction of red meat may have little effects on major cardiometabolic outcomes, but we should mention that substituting red meat with high-quality plant food helps reduce LDL level, and higher intake of unprocessed red meat, which means a natural red meat, for example from cow source, from sheep, is associated with 3% increased risk of cardiovascular disease. That's why the World Cancer Research Fund recommends reducing red meat consumption to 350 to 500 grams per week, not per day. So try to reduce red meat consumption as much as you can, which can help to reduce cholesterol level and also help to reduce cardiovascular disease. But when we speak about the processed meats, which is one of the worst types of diets nowadays, processed meat, of course, is associated with higher risk of cardiovascular disease, besides containing high salt content. This includes the sausage, hot dogs, salami, pastrami, or corned beef. All of these types of meat is completely dangerous, that we should advise the patient to reduce their consumption or even avoid processed meats. That's why many of the older generations, when we speak about meats, they prefer the red meats because they are the natural types of meat, and they avoid the processed meats because they are completely dangerous due to industrial processing. The dilemma of alcohol consumption, I will try to summarize it in a scientific way. We all know that there was an upper safe limit of drinking alcohol in most of the old guidelines of about 100 grams of pure alcohol per week, and drinking above this limit lowers the life expectancy. But this is scientifically true or not? The results from multiple epidemiological studies suggested that higher alcohol consumption is associated in a linear relationship with higher risk of stroke, coronary artery disease, and higher risk of heart failure due to the myocardial depressant effect of alcohol. Maybe moderate alcohol consumption is associated with lower risk of MI, but the dangers of alcohol consumption is much more the benefits. So in these guidelines, the Mendelian randomization study do not support the apparently protective effects of moderate amounts of alcohol versus no alcohol at all, as the lowest risk of cardiovascular outcomes are in abstainers, because any amount of small alcohol uniformly increase the blood pressure and also increase the body mass index due to the high content of calories. So in these guidelines, it is against the concept of moderate alcohol consumption, because the no alcohol is associated with lower cardiovascular risk than the moderate alcohol consumption. And the famous question asked by many patients about the dangers of sugar-sweetened drinks versus artificially sweetened drinks. In the famous Nurse Health study, it showed that regular consumption of sugar-sweetened beverage is associated with 35 higher risk of coronary artery disease in females, but this risk was not shown in artificially sweetened drinks. But in another study, which is the EPIC study, it shows that both types are associated with all-cause mortality, and the artificially sweetened was associated with the risk of circulatory disease. That's why the WHO recommends a maximum intake of just 10% of energy intake from free sugars, which include added sugars and the sugars present in the fruit juice. So we should reduce the intake of these drinks as much as we can to reduce sugar intake, which would have a detrimental effect on the risk of cardiovascular disease. And for the coffee lovers, what about its benefits and dangers? For the non-filtered coffee, which includes the boiled, Greek, Turkish, and some types of unfiltered espresso coffees, they contain LDL-raising substance, which may be associated with 25% increased risk of cardiovascular mortality, but when the individual consume 9 or more cups of coffee per day, which is a heavy consumption of coffee. But when we speak about moderate coffee consumption, about 3 to 4 cups per day or less, especially for the filtered coffee like most of the espresso coffee, this is probably not harmful. It may be even moderately beneficial for some individuals. So I should not advise the individuals to stop coffee intake, but I should advise him to drink moderate amounts of coffee rather than heavy coffee consumption. So all this talk about the healthy diet drags us to a famous healthy dietary style, which is the Mediterranean diet, which includes a high intake of vegetables, fruits, legumes, whole grain products like oats, barley, brown rice, fish, olive oil, which is a famous source of polyunsaturated fatty acids, and unsalted nuts, and reduce the intake of red meat, dairy products, saturated fats, and carbohydrates. So the task force this year has a class 1 recommendation for a Mediterranean or a similar diet to lower the risk of cardiovascular disease, replace saturated with unsaturated fats, reduce salt intake to lower the blood pressure and the risk of cardiovascular disease, choose more plant-based food pattern rich in dietary fibers, including whole grains, fruits, vegetables, pulses means the legumes, and the nuts. Also class 1 to restrict alcohol consumption to maximum 100 grams per week. Although we spoke about the refused idea of moderate alcohol consumption, but so far the recommendation is for less than 100 grams per week. Recommending to eat fish, especially fatty fish rich in polyunsaturated fat and omega-3 at least once a week, and restrict or avoid processed meats, and restrict free sugar consumption, particularly sugar-sweetened beverage, to a maximum of 10% of energy intake. So if I give a summary about advising the patient to adopt a healthy diet, I would advise him for more plant and less animal-based foods, at least 30 to 45 grams per day dietary fibers, preferably from whole grains, 1 to 2 times fish per week, more than 200 grams vegetables per day, more than 200 grams fruits per day, and more than 30 grams per day of unsalted nuts. And if I want to advise him about avoiding the unhealthy diet, I would advise him to reduce saturated fat to less than 10% of total energy intake, replacing it by monounsaturated fatty acids and whole grain carbohydrates. Avoid trans fats as far as possible. Low or very low carbohydrates intakes, less than 5 grams per day salt, and optimal to be less than 3 grams. Less than 350 to 500 grams per week red meat, and try to avoid the processed meats. Less than 100 grams per week alcohol, and abstinence is of course better. Avoid sugar-sweetened drinks and avoid artificially sweetened drinks. And the net result of the regular exercise and healthy diet, or lack of exercise and unhealthy diet, is the effect on body weight and composition. We should emphasize that maintaining moderate weight loss of 5 to 10% from baseline has a positive impact on risk factor, including improvement of blood pressure, lipids, and improvement of glycemic control. And we can see this frequently in our clinical practice. In elderly, there is an important concept that the weight loss may be associated with lower morbidity but higher mortality due to the muscle wasting or the sarcopenia, which raise the concept of obesity paradox, which we have spoken about this in the initial videos of the guidelines. So in elderly, the emphasis should be more on maintaining muscle mass and good nutrition, and less emphasis on weight loss due to maybe some negative impacts of late weight loss in elderly. So if a patient asks me about my advice to lose weight, I should advise him about regular physical exercise, advise him about diet regimens that restrict energy intake for specified time periods like intermittent fasting or time-restricted eating, and advise him about energy restriction in diet using hypocaloric diets, for example, Mediterranean diets, more plant-based foods, low fat and low carb diets, high protein diet to maintain muscle mass, avoid refined sugar, and increasing fruits and vegetables. Regarding the famous issue of weight loss medication, what are their benefits and their dangers? Of course, they help to achieve weight loss and maintaining optimal body weight, but sometimes at the expense of some side effects. And in a meta-analysis of medication-assisted weight loss, they found some favorable effects on blood pressure, glycemic control, and cardiovascular mortality. So some patients may resort to weight loss medication if they fail to achieve weight loss using lifestyle medication, but this should be a doctor advice, not just some over-the-counter or commercially famous medications. And regarding bariatric surgery, in a meta-analysis, it indicated that patients undergoing bariatric surgery had more than 50% lower risk of total mortality, cardiovascular, and cancer mortality compared with people of similar weight who did not have this opportunity. So I should not omit this opportunity for some patients who also fail to achieve weight loss using lifestyle modification, because obesity, as we know, is considered to be a chronic metabolic disease and it has some genetic elements. That's why some patients may fail to achieve weight loss using standard practice. So at that time, bariatric surgery may be a solution, but by advice of a surgeon who chooses the suitable type of surgery that is beneficial for this patient, and he can discuss the benefits and risk with the patients. So the task force has put a class 1 recommendation that encourage overweight and obese people to reduce weight in order to improve blood pressure, dyslipidemia, and risk of type 2 diabetes. And range of diets may be effective for weight loss, including the healthy diet, which should be encouraged for most individuals. Regarding the bariatric surgery, it has a class 2A for obese high-risk individuals, as it should be considered when lifestyle modification does not result in weight loss. But of course, as we mentioned, it should be an advice of a dietitian and a surgeon. So at the end of this lengthy video, our take-home message that it is not enough to tell your patient just improve your exercise and improve your diet without giving him precise, easy, and reliable steps to implement in order to achieve optimal lifestyle. So it is not just an order you give to the patient. You should explain to him in detail as much as you can how to implement this. Thank you very much for watching this video, and wait for the next video regarding mental health and smoking intervention.